Okay, so my senior seminar presentation was on the relationship between anxiety disorders and seizures. My interest in this, I suffer from an anxiety disorder and epilepsy. My hypothesis, so I wanted to add this from the GAD-7. The frequency of seizures reported is higher among people with higher anxiety severity as compared to people with lower anxiety severity. It is anticipated that this research will reveal a significant positive correlation between anxiety disorder severity and seizure occurrence. Background: anxiety disorder is seen in approximately 19.1 of adults in America each year. It's a disorder that involves excessive worry, apprehensiveness, and behavior disturbances. Epilepsy, on the other hand, with recurrent unprovoked seizures, is seen in approximately 1.2 of Americans. Recent studies have postulated that anxiety can induce or exacerbate seizure activity in individuals with epilepsy, but little is yet known about the nature of such a relation. I found a lot of research that proved how having seizures can have a patient develop anxiety disorder after the fact, but I could not find a lot on anxiety disorder being a factor before the seizures occur. A lot of studies have utilized non supporting claims in smaller samples. Studies have considered only epilepsy and not generalized anxiety disorder, and this can lead to poor diagnostics and unobjective self ratings. Studies have also not considered significant covariates such as age, medication, and comorbid disease. This disease refers to this simultaneous presence of two or more medical conditions in a patient, often co-occurring with a primary condition, for example, epilepsy. And this can also have an impact on anxiety as well as the development of seizures. So the research that I found, the prevalence of anxiety in seizure populations, individuals with seizure disorder or epilepsy suffer from anxiety disorder at alarmingly high rates compared to the general population, compounding both neurological and mental health complications. Research identifies high occurrences of anxiety in persons with epilepsy and other seizure disorder cases. According to a study conducted by Forthofer, 50% of refractory epilepsy patients showed significant symptoms of anxiety, which is a much larger proportion compared to the general population. Physiological mechanisms linking anxiety and seizures. This was investigating the physiologic processes between anxiety and seizures, and this can inform therapeutic targets for improvement in both disease processes. Investigators have also examined neurological and physiologic processes between anxiety and seizures. Haveri also postulated that brain activity responding to stress, such as in the hippocampus, this could underlie increased seizure activity. Their studies involved fMRI studies, and through these studies, significant neurophysiological overlap between anxiety and seizures was confirmed. Cano Lopez and Gonzalez Bono also did a similar investigation of the function of deregulation of cortisol between anxiety and epilepsy. Chronic anxiety is associated with the elevation of cortisol, and this lowers the seizure threshold and increases seizure frequency. More research continued. I looked at the role of mental health interventions in seizure management. Mental health interventions play a key role in controlling seizures through increased compliance with therapy and overall improvement in patient life. Several studies have analyzed mental health interventions in reducing seizure frequency. I looked at a Hoffman study, and they performed a similar one, and subjects experienced significant improvement in symptoms of anxiety and reduced seizure frequency. The trial emphasized controlling seizures through non-pharmacologic interventions, and these studies stress that Psychological factors are responsible for increased seizure activity, and they must be addressed. The gaps that I found in my research, most studies have focused exclusively on individuals with epilepsy and had no consideration for the larger group with non epileptic seizures. Confounding factors such as the use of medication and the presence of comorbid mental disorders have not yet well been addressed in terms of contribution of seizures. For my methods section, I used a correlational design to determine the relationship between anxiety disorder and seizures. Anxiety disorders will be studied in 200 adult participants between 18 and 65 years of age who are diagnosed with anxiety disorder. Participant eligibility will also be limited to people who have confirmed diagnosis of an anxiety disorder, for example, GAD or SAD. It also must be documented that participants have a history of seizures in medical records. Then I use the GAD-7 scale, and that's used to measure anxiety severity. This can be used in several clinical settings, and this consists of 7 items scored from 0 to 21, with higher scores indicating more severe anxiety symptoms. The participants will also complete a seizure history questionnaire to assess the frequency and characteristics of the frequency of seizures. To add to that, they will also assess the number of seizures during the past year, what caused the seizure, how long the seizure lasted, and how well that the patient could recover after the seizure. Pearson's R could evaluate the linear relation between the frequency of seizures that are reported by participants and medical records versus the severity of the anxiety disorder as rated with GAD-7. The significance in the why to this study. This research is essential for advancing knowledge in clinical psychology, as well as neurology and healthcare. This will benefit clinicians by possibly leading to modified treatment approaches, improved patient care, and better preventive interventions. These observations could have significant implications for practice and research if confirmed. They could cause clinicians to implement a more coordinated model in treating patients with a diagnosis of anxiety disorder and epilepsy. And this proposed research is warranted to inform an enhanced understanding of the relationship between anxiety disorder and seizure frequency, a matter of significant clinical concern, but with little overall investigation and research. By examining whether and to what extent the severity of anxiety is predictive of seizure activity, the findings can inform both psychological and neurological practice. And these are my references.